HIV giants clash as AHF calls out greedy Gilead.
Stop being greedy! Stop being greedy! Stop being greedy! Stop being greedy! Stop being greedy!
Mr. Daniel O'Day, you are too greedy. You have enough money. How much is enough?
Gilead!
We need you to lower the prices of your pharmaceutical HIV drugs. Many people are dying to get HIV treatment.
Gilead! Gilead! What are they? What are they?
The research they're doing for the medication for people living with HIV, and I live with it, our conditions. Let it go. Do right by us.
I want them to make every medicine affordable for everybody, everywhere, because we need it.
What I'm doing out here is that I'm protesting against Gilead and their greediness.
They're trying to mess with 340B that help our clients, that help clients like me. 340B is a program that doesn't affect the taxpayer. Why would Gilead try to focus on making it difficult to help patients? They're just so greedy.
AHF has taken its grassroots Gilead advocacy global, and AHF Mexico kicked it off this week with a protest at Gilead's Mexico City headquarters, demanding that the pharma giant put lives before profits. The Learn paired their demonstration with a Twitter rally, generating significant interaction with digital advocates, 1.1 million impressions and 50,000 engagements. Along with posters, protesters donned a list of actions the pharma company must take, including halting its patent monopoly on medicines to treat HIV/AIDS, hepatitis C, and COVID-19. Participants called out the company for its obscenely high drug prices while generating $27 billion and paying its CEO $19 million in 2021 alone. AHF Bureau Chief of Latin America and the Caribbean, Dr. Patricia Campos, said, quote, "We have a long history of challenging pharmaceutical companies, including Gilead, on their greed and profiting off the world's most vulnerable and sick people," end quote. AHF Mexico's actions are the first of many upcoming global initiatives to pressure Gilead to stop its greedy tactics. As per the protesters, Gilead's greed knows no end as it overprices life-saving drugs, refuses to register some medications in lower-income countries, and consistently blocks attempts to introduce cheaper generic versions of its medicines. Big pharma. It's not just Gilead that is doing this, obviously. And do we wish that there were cheaper, more accessible generic drugs to all drugs that people need right now? Of course we do, and making pharma accountable would be fantastic. Is anything going to come out of this? I'm not really sure.
So I have a couple of thoughts on this, on both sides. First I have to say that Gilead is a sponsor of the Smart Right. I also have to say that AHF has been a sponsor of the Smart Right. So there's an economic benefit to Smart Right by both organizations. But AHF has had a history of suing. They've sued Johnson & Johnson's. They've sued the city of Baton Rouge. They've sued the city of Los Angeles. And it goes back to like 2008 and again in 2019. The dates just keep happening where there's doing the suing. Who benefits from those lawsuits? It's certainly, if they're protecting me, I'm not seeing that money. It's going back into the money that they have. On the other side of that, AHF is sponsoring all the things we care about. So whether it be Pride of the Americas or whether it be Pride Fort Lauderdale or the AIDS life cycle in California, a lot of that money is being thrown in from Gilead to these organizations. I am not big on the cost that they charge us, but we still want the research to go on. So if we pull their funding, are they going to pull and not care as much about our research? And then you go back to who's funding these 340Bs that AHF is getting its money from. It's the pharmaceutical companies that gave that money so that an AHF and a CAN and all these other organizations can exist.
I'm sorry, Glenn, what's a 340B?
340B is money that the pharmaceuticals put into that has created AHF. It's where most of their funding comes from. So it was from the profits that they're making. They all put money into the 340B, which is this huge pocket of money that a couple of years back, and probably 2 decades now, where AHF discovered this money, where Community Health in Florida discovered this money, and suddenly have these huge baskets of cash to throw around. So you're shooting yourself in the foot by attacking or AHF attacking Gilead, which is giving them some of the funds, which is Johnson & Johnson is doing, and some of the others. So it's really an interesting story to be suing the people that feed you, and at the same time, the people that are also sponsoring a lot of the things that we couldn't do without that money, from both of them.
Now, every month I'm on PrEP. I'm on Discovery, which is the child of the Truvada, which I also believe is Gilead. My insurance company will say, $2,600 for your monthly thing, copay and everything gets it down to like $10 a month or something like that. But a lot of this is like it was in Mexico. It's in second and third world countries where the government doesn't have these things programs set up where we're the ones that kick in the money. They don't have the insurance companies that will pay for it, and so they rely on NGOs. The second thing to remember, though, on the other side is that it takes, and this was a couple years ago, so it's probably more, $2 billion to bring a market from concept inception to market. And that doesn't count all the failed attempts, the ones that die in phase 2 and phase 3.
Billion
dollars. So, and they did, when we say 27 billion, I don't know if that was in total revenue or profit. If it was total revenue, well, that's just selling, but that's not counting for everything that they've had to pay out along the way. It's a tough issue. Americans generally overpay. We overpay for medicines because they're developed here, and they do get them cheaper in the Eurozone and Africa.
Keep in mind that who sets those prices? When Medicare agrees to pay for these drugs, they set the price that they're willing to pay. And when insurance companies agree to pay these prices, ultimately our monthly buy-in to these insurance are part of our policy, it goes up in price because they've agreed to pay them for this. So it's this, again, this whole circle, like you can blame the government for not being tighter on our drugs. They just made it so that diabetes drugs are only, $30 a month, $3 a month, something crazy. We can't go higher than that.
Glenn, I want to ask you, it's interesting from your perspective of long history with Smart Ride. So you compare and contrast the two positions. That's really crystal clear. Who's going to win this argument? Is AHF going to win or Gilead going to win?
It's going to depend on when the 340B money runs out. There's no one fighting.
Is that any time close on the horizon?
They've been talking about it being short funds for probably 10 years, but yet they still somehow are pumping it out into the community. And a lot of the local agencies now have a piece of it. They have filed and learned how to. So some of their funding, when you've seen this growth in a lot of local organizations, it is part of the 340B money that they're getting that's allowing them to build a new building or expand their services.
Yeah, we forget, just to provide an exclamation point or a highlighter, AHF is getting ready next month to put on the Florida AIDS Walk. And that is arguably a $2 million dollar match for so many organizations in LGBTQ community. It's confusing to me of who's wearing the white hats and who are wearing the black hats here. The one thing that gives me pause, which I don't like, and it makes me go, gosh, I've got to read and I've got to learn more, because I don't know enough about this issue, is the attack of how much money Gilead makes. Would we say that about a car company? Would we say that about, in various...
Is it coming from these drugs, or is it coming from their entire portfolio?
Yeah, exactly. And so we have to be extremely careful about the attack on corporate capitalism and their generation of profits. Those are two different things. And one of the things that frankly brings me to pause, if Gilead can justify their CEO making $19 million a year, there's probably a very, very good reason in the competitive nature of that CEO to be able to have a compensation package like that. I've seen compensation packages in $30 and $40 million based on compensation. Elon Musk, as example, and he's an extreme example, is because of the corporate value that they say from that seat. To attack the idea that you're not worth $19 million is a very dangerous argument because you are quantifying value only on a number, which frequently is not true in a corporate situation. And when you publicly are demonstrating that the CEO shouldn't make $19 million, that is very superficial in its summary. And then I wonder, wait, what other superficial summaries are taking place here? And so for me, I come away from this story because, to be honest with you, I'm not as informed as you are in this battle between AHF and Gilead, but it affects all of us.
Of course.
It affects our community. It affects HIV. It affects the research of cure, which is really the most important to us, and it affects the support of our LGBTQ community in so many different ways. This is a gigantic story for all of us, and I'm concerned that we would, as LGBT, get caught up in the nuances of the story as opposed to the impact on us, because it virtually impacts every single LGBT person that is listening to my voice. This is a big story.
And we all know that individuals are not paying those prices. You know, individuals are getting them from CAN, Community Health. They are getting it from AHF. They're getting it from Broward House, and they're getting it from all these other organizations that they're being supplied with these drugs. Or the insurance company, like in my case, my insurance company picks up the price of it. I don't know any individual that I know that's rich enough that could pay for all their medications. You know, there's one medication that's like $8,000 a month at one point. So you go, I take 13 pills. Like, how much can a rich person even pay?
Glenn, one last question. This demonstration took place in Mexico City. Have you heard anything like that going on here in U.S. or in South Florida?
Not recently, but I mean, it did happen in California. I mean, I remember hearing about it in San Francisco or New York and some of the bigger cities where they may have a bigger presence. And AHF has a big presence there.
Okay. There you go.
LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Lara are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.